We are going to talk about syphilis. Do you know that syphilis is easily curable? Only if it is untreated, it can be deadly. So this is a patient with multiple penile chancres. Chancre is the primary stage of syphilis. This patient has multiple chancres on the penis. This is the primary syphilis. So when we talk about syphilis, it is caused by a spiral bacterium called Treponema pallidum. Right? So the disease syphilis occurs in 4 stages. Primary syphilis, the lesion is chancre, that's what you already saw. Secondary syphilis, it is usually the skin rash is the dominant manifestation. Latent syphilis, no symptoms at all. Latent syphilis, asymptomatic patient. Tertiary syphilis, it affects the deep tissues, cardiovascular system, nervous system, and even skeletal muscles and bone. Right? So those are the stages of syphilis. So first we'll start with the primary syphilis. So the primary syphilis. So the organisms enter through the skin abrasions that occur during sexual intercourse. Right? Normally, if the patient, if somebody is having sexual intercourse with an infected partner, then if the infected partner has syphilis, that is, the other person can get syphilis. So the primary syphilis is the earliest stage. So it presents as painless ulcer. We call it chancre. It occurs about 6 weeks after the exposure. Normally, average is about 3 weeks. So the painless ulcer, right? It can occur anywhere. In males, it is on the penile shaft. In females, on vulva, in the labia, and maybe outside or inside, even in the cervix, right? So these are painless ulcers, right? So the patients don't worry because they are painless, right? And also there can be enlarged inguinal lymph node, groin lymph nodes, right? That is also painless, right? So that is why some patients don't go to take treatment because they automatically get the symptoms disappear automatically. These primary symptoms of primary syphilis disappear, right? And then comes the secondary syphilis. We'll talk about that. So how do you diagnose primary syphilis? By the appearance of the lesion, and also by doing some blood tests, right? When you go to the doctor will write some blood tests and that will confirm the diagnosis, right? How do you treat primary syphilis? Just single injection of long-acting penicillin. There's a long-acting penicillin called benzathine penicillin. You get single injection, you are completely cured, right? So it can easily be treated. So this is the primary stage. So primary stage lasts for about 6 weeks and then the symptoms disappear, right? Even without treatment, right? Untreated, then it go to the secondary stage. Otherwise, if you get the treatment at this stage, it does not progress at all, right? Untreated only it progress to the secondary stage, right? This is syphilitic chancre on the tongue. So depending on the sexual practices, they can get the chancre on different parts of the body. So this is the secondary syphilis, right? So secondary syphilis, the major manifestation is the skin rash all over the body, even including palms and soles, right? So the rash is like maculopapular rash, and there can be low-grade fever. It can also be diagnosed by blood testing. And that is also treated with single injection of long-acting penicillin that I told, benzathine penicillin, single injection, completely cured, right? This is secondary syphilis. If treated, then there is no progression. Patient is completely cured, right? And if untreated, it can go to the latent syphilis, next stage, latent syphilis. This is secondary syphilis of a patient. You can see the skin lesions, maculopapular rash, and latent syphilis. So there are no symptoms. Patient is fully normal, right? How do you diagnose it? Just doing the blood test. If the patient comes with the history, I had these symptoms, I had some ulcers, then I had some skin lesion, then the doctor will do some blood test. Then he will tell, okay, you are in the latent stage of syphilis, right? Latent stage of syphilis also can be treated with long-acting penicillin, benzathine penicillin. Early latent syphilis that lasts less than 1 year is treated with single injection of benzathine penicillin. If it is late latent, that is more than 1 year, then it is treated with 2 or 3 injections of benzathine, penicillin. So that is latent syphilis is also easily treatable. If the patient doesn't take treatment during the latent at any stage, then it can progress to the, after latent syphilis, it can progress to the tertiary syphilis. Tertiary syphilis, it can affect the cardiovascular system. Cardiovascular system means it can affect the heart, especially the aortic valve that separate the left ventricle from the aorta. The aortic valve can be affected, and also aorta can be affected. They result in dilatations of aorta. We call them aneurysms. They can rupture at any time, and so those changes can occur, right? Aortic valve, especially aortic aneurysms, can occur. The neurosyphilis is affect the brain and spinal cord. If it affects the brain, we call it general paralysis of insane. It is like it becomes a psychotic patient, crazy patient, psychotic patient, right? It's like schizophrenia, right? Then spinal cord is affected, patient cannot walk and patient become paralyzed, right? So now these cardiovascular syphilis and neurosyphilis, you can't reverse the effects. The patient have already developed these symptoms and they cannot be reversed. You can treat the syphilis, but even the damage that had occurred is irreversible, right? So it's a disease that can, if you get treatment early in these stages, it can be cured. Now these second tertiary stages is not curable. Curable means it can be, the syphilis can be cured, but the damage cannot be reversed. Right. Then also there is gammatous syphilis. Gamma means there are low lumpy lesions called gamma, the skeletal muscles and bone. They can be treated, but neurosyphilis, cardiovascular syphilis, the damage cannot be reversed. Tertiary syphilis. So how do you prevent? Safe sexual practices, right? Barrier contraception, using a condom, right? And if you feel that if you are infected and possibility of being infected, consult your doctor without delay. Remember, it is easily curable at early stages. It's easily curable at early stages. It's a simple disease if you get the treatment at early stages. But best thing is prevention, because these can lead to long-term consequences. So it's best thing is to prevent, taking precautions. I hope you enjoyed the lecture. We'll see you with another episode near future. Right?